During the past 25 years, I've taken part in a lot of medical emergencies, but nothing on a scale of the Katrina disaster. The thing that surprised me most was the spirit of the New Orleans evacuees. Some had gone through a terrible ordeal and still had a sense of humor.
My friend Gary, who lives in the same complex that I do, said before the storm hit that we could use his card. Well, we never said which Walmart in which state. So when he called, we saw the number on the caller ID, and I'm like, it's Gary. I don't think I want to answer this, but he was extremely relieved that we were safe in Houston.
Children seemed to feel their stay in Houston was just another outing. They roamed the George R. Brown Convention Center, riding tricycles and playing games.
Go upstairs for a little bit, okay? Bye.
You want to come back down? Okay, bye.
The people that came to volunteer at the George R. Brown were from throughout the country. They had seen pictures of the evacuees and wanted to help out.
I'll make a joyful noise unto the Lord. I'm gonna dance a new dance, and this just won't happen by chance. I'm trusting in the Lord with all my heart, and let him run the record fire. Yeah, shut up in my soul. God is doing what he wants me to do. So the devil better leave me alone. I'm coming with fire.
I have a list of some songs and some songs that they might want to sing. I try to follow along on the guitar.
Why I volunteered? The reason I volunteered is because my love of the fellow man. I mean, humanity. I just can't stand to see anybody suffering and sit by and just not do something. You know, I might not have the money, I might not have the resources, but make the time, because I never know when I might be in this kind of situation, and if I ever were in this situation, I would want somebody to reach out and help me.
But right now, they're holding up all right. I don't think that most of them realize what kind of a situation they're in. I don't think the reality of the situation has really hit them. We had a elderly couple this morning that their son had flown in from California. He had plane tickets to take them home to California with him, and they didn't want to go. They're thinking they're going back to New Orleans within the next week.
Many evacuees arrived at the George R. Brown with medical problems. Medical care was set up through the University of Texas Medical School at Houston. During the first full day the center was open, 38 patients were taken to hospitals throughout the Houston area by such organizations as the Houston Fire Department and private EMS organizations such as AMR.
Well, they've learned from the mistakes that they had at the Astrodome, as far as, you know, just trying to figure out how to get people and keep them in order and keep them happy and stuff. So, you know, the facilities are nicer and they're not as crowded, so people are generally happier.
We're having to utilize facilities that are not only close to here but also very far out in the community, so it requires a little degree of coordination. The general condition is remarkably good. I mean, you have your typical problems that you'd associate with someone who's been in an emergency situation for several days, dehydration, situations related to them not taking their medications, issues like that. Anybody with a chronic health problem, of course, is going to have potential for significant issue if they don't take their medications for a few days. So those are the type of problems that we're seeing.
The medical section of the George R. Brown was well organized. Every evacuee underwent a medical assessment upon arrival.
After they see a nurse or a doctor, the doctor or nurse fills out this form, and then now we're just entering all the data.